Hello, and thanks for joining us for another video in our ongoing series for pit count volunteers. My name is Abigail Kornberger, and I am an HMIS data analyst at the Indiana Housing Community Development Authority, or HCDA. In this session, we will be covering a quick guide developed previously by the Homeless Health Infectious Disease Program. The How to Stay Safe During Respiratory Season quick guide will cover recommendations and tips to keep yourself, fellow pit count volunteers, and the community you are interacting with safe during the pit count event. So let's start with some background. Why is this a concern at all? Respiratory season varies from region to region, but is generally considered to be the time period between October and February, with peaks of activity beginning in December. The pit count takes place every January, usually within the last 10 days of the month. This training aims to provide you with the tools to stay safe while completing the pit count during what could be a high period of respiratory activity in your community. We will be covering the subject content from each section in this session, but the quick guide is available for viewing and download at the web address below. You can also scan the QR code to the right to view the guide as we move through this session. This may be a valuable resource to have physically or saved on your mobile device during the pit count event. So let's dive into each of the 4 sections of the quick guide. First, a few general tips and reminders. For volunteers, you are encouraged to dress appropriately for the weather, walking distance, and your own comfort during the pit count event. Bundle up if necessary. Remember that several layers of loose-fitting, lightweight, warm clothing will provide more protection than one layer of heavy clothing or a winter coat. Additionally, it is important to utilize a hat or head covering when in cold, rain, or snow. Ensure that all exposed skin in cold temperatures is covered if possible. Heat loss is proportional to the amount of exposed surface area on the body. Continuing now with a few additional clothing-related exposure tips. Scarves can be used to protect the lungs from irritation due to possible cold wind exposure. If you are in wet conditions or there is snow on the ground during the pit count event in your region, try to stay as dry as possible. Water-resistant outerwear and footwear may provide the best protection in these conditions. Next, we are going to cover the second section of the quick guide, which includes recommendations for interacting with unsheltered individuals and families. When approaching individuals staying outdoors for a pit count interview, never sneak up or corner someone. It is important that you as a volunteer are respectful of the individual's personal space, physical space where they live, and the community in which they live. To reduce the risk of respiratory illness spread during the pit count, greet individuals from a distance of 3 to 6 feet. Teams are encouraged to maintain distance throughout the conversation for visibly symptomatic individuals or those who do report to be ill. We will provide an additional resource for this later in the session. It is also important that you identify yourself and the agency you are working with in these interactions. An example of this could look like, hello, my name is blank and I am with blank agency. We'll be providing more guidance on navigating these conversations in a separate training session. Let's continue to a few more recommendations when interacting with unsheltered individuals and families while still protecting yourself and the community during respiratory season. The How to Stay Safe During Respiratory Season Outreach Team's quick guide includes a 1-minute respiratory symptom screening tool. This tool aims to identify influenza-like illness, or ILI, or similar symptom-producing respiratory illnesses. Pit count volunteers may begin their interaction with individuals and families staying outdoors after properly identifying themselves to the individuals with this tool. Outside of this screening tool, pit volunteers are encouraged to maintain good hand hygiene and practice respiratory etiquette throughout the count. It is recommended that volunteers wear a mask if unable to maintain a 3-foot distance, 3 to 6 feet distance from visually symptomatic individuals or those who report to be symptomatic. This will vary from region to region, and pit volunteers should refer to the guidance of their pit coordinators, but outreach teams are encouraged to provide clients with hygiene products and other community resources as available. We've mentioned respiratory hygiene and hand hygiene. Let's now define them. Individuals are encouraged to cover their mouth when coughing or sneezing, use tissues and throw them away, and wash their hands or practice hand hygiene when coming into contact with their mouth and/or nose. Proper hand hygiene involves utilizing hand sanitizer or washing the hands with soap and water. When using hand sanitizer, remember to use an amount the size of a quarter. Dispense this quarter size amount directly into the palm and then rub both hands together, making sure all surfaces of the hands and fingers are covered. And this may take about 20 seconds. It is important to remember not to rinse or wipe off the hand sanitizer before it is dry. When washing hands, wet hands first with water and apply soap. Rub vigorously for at least 20 seconds, making sure that all surfaces of the hands and fingers are covered. Then rinse hands with water and dry thoroughly with paper towel. These measures will reduce the risk of any contact transmission between your fellow Pit Count volunteers and the community that you are interacting with. We are already nearing the end of this training session, so let's take a look at our last tool, the 1-minute respiratory screening tool we referred to in an earlier slide. If an individual responds yes to any question 1 through 4, it is recommended that you maintain a 3 to 6 foot distance and/or wear a mask during the interaction. This is not a required portion of the Pit Count or Youth Supplemental Survey workflow, but it may assist you in limiting your respiratory illness exposure. As a reminder, this tool and all of our recommendations we covered in this session are available on the How to Stay Safe During Respiratory Season quick guide on our website, and that is also available on the earlier slide. As a Pit Count volunteer, you are encouraged to utilize self-care, stress management, and coping resources following your Pit Count shift. It is important to note that this may be a stress-inducing experience for both you and the interviewees. Self-care can be either an individual or peer-based activity. Individual activities may include exercising, journaling, and reading or meditating. You may also partake in a debrief with your fellow Pit volunteers if you feel that a peer-based activity would be more effective. A debrief is a form of peer-based emotional support where you talk about the experience and share reflections after an event. No matter how you practice self-care, all Pit volunteers are highly encouraged to schedule time to rest and recharge after their Pit Count shift. When interviewing people sleeping in unsheltered locations, be mindful of whether they have enough layers to stay warm during the current weather. If they are dry or in a dry area, these factors may increase their risk of developing hypothermia or frostbite, and whether or not you can see the rise and fall of their breathing. In any emergency, you are encouraged to contact 911. Take pride in the work that you've contributed to the Pit Count. With you, the count would not be feasible. Thank you for attending this training session. If you have any questions about the content of this training, please do not hesitate to reach out to our COC Engagement Manager, Jessie Van Hooser, at the email address here on the screen. Thank you.